Good morning, good afternoon, good evening. I know I'm talking to you in various time zones. Thank you for being with us today. My name is Krista Bombera, and I'm pleased to welcome you to this event, which highlights the results of 3 years of research that was carried out to improve our understanding of inequalities. This is an area of research that could not be more topical, as the current pandemic is clearly widening the already growing gap between rich and poor. The results are presented in the framework of the EU AFD Research Facility on Inequalities, funded by the European Union and implemented by the Agence Française de Développement, the AFD. Neither the European Union nor the AFD need much introduction, but allow me to briefly tell you about the EU AFD Research Facility on Inequalities and its work. The EU and the AFD launched the facility in 2017. It is devoted to enhance the knowledge and understanding of social and economic inequalities. The goal is to identify their drivers and underlying factors at different spatial levels, as well as to define the most effective policies and approaches to reduce inequalities. In fact, one of the AFD's main operational strategies is for 2018 and 2022 to help reduce inequalities and strengthen social links. Thus, the opportunity for the AFD to work with the EU on this topic was particularly timely and has allowed the AFD to go one step further in its research. Besides, this program is enabling the European Commission, the AFD, and European like-minded donors to build a platform for dialogue and an ecosystem at the service of sustainable development. The 23 projects funded by the facility have mobilized more than 60 researchers and 40 AFD agencies, EU delegations, and different local authorities and governments in more than 20 countries. The projects combine country and city analyses, global research, and the development of tools. These research projects will only truly have fulfilled their promise if they become a launching pad for policymakers and other stakeholders. It is essential to translate results into actions that can effectively reduce inequalities. Today, we'll have the pleasure of hearing from the experts who have contributed to achieve the incredible results we have today in their respective fields. We thank them all for their collaboration. And now let us start with the testimonial of Professor Manuela de ALLEGRI of the University of Heidelberg. It is an honor for me to be here today with Professor Manuela de ALLEGRI. Welcome, Professor.
Thank you.
Thanks for being with us today. The research project that we're going to talk about now is titled Assessing Equity in Health Spending in Sub-Saharan Africa. It has been carried out in the framework of the EU AFD Research Facility on Inequalities under the leadership of Professor Manuela de ALLEGRI. The project has provided us with extremely interesting results, and the topic addressed is more relevant than ever. Professor, could you please explain what this project consisted of? And first of all, what motivated you to do this type of study and how it differs from other studies?
So thank you very much for giving me the opportunity to talk about our project. Our project explored equality in health spending, considering both public and overall health spending in 3 different African countries, specifically Burkina Faso, Malawi, and Zambia. We looked at how equality in health spending changed over time in relation to the implementation of universal health coverage financing policies. We got motivated to conduct this project because we noticed that the implementation of universal health coverage policies had been accompanied by numerous evaluations looking at effects and equity effects, but then no research had been carried out to look at to consider how health spending itself changes as a function of the implementation of these interventions. And therefore, we wanted to fill this gap in knowledge.
Professor, in terms of inequalities, how has the project evaluated in the 3 countries in focus the effectiveness of universal health coverage policies?
So I should say that we have not been able to fully evaluate effectiveness. I would like to make a point in relation to your question. We're really looking at how health spending has changed, but we cannot really draw conclusive statements about effectiveness itself. What we have used is an economic tool known as benefit incidence analysis, which relates information on health spending. So how much does the provision of health services cost, with information on health service utilization, whereby we looked at utilization stratified by socioeconomics data. We use concentration curves to look at how the distribution of health spending matched the distribution of health service utilization. And we did this across the 3 countries for different time points. So looking over time in relation to the implementation of universal coverage policies for different services, curative services and maternal care services, and for different levels of care, primary care versus secondary care, and when possible, public facilities versus private facilities. So we tried to give really an overview of what had happened in terms of health spending over time.
What are the main recommendations in terms of public policies that arise from your study, perhaps more relevant than ever in this context of health crisis?
I have to say that we were positively surprised by our findings, because actually across the 3 settings, we found increasing equality, increasing equality in the distribution of health spending across sectors. So whether we looked at curative services or maternal care services, whether we looked at primary or secondary care. So we do have information suggesting that the implementation of universal health coverage policies increased equality both in public and in overall spending. However, since we also conducted a geospatial analysis looking at differences within countries, we noticed that important differences, an important source of heterogeneity, persist, with some regions experiencing greater inequality than others, and some sectors, in particular the private sector and secondary care, experiencing also higher inequality than lower levels of care in public sector. This suggests that there is definitely need for further interventions, for further research in the first place to understand this heterogeneity within countries, and then for interventions to tackle this heterogeneity and really bring even greater levels of equality.
Professor Di Allegri, thank you for being with us today. And thank you very much for the invaluable work that you've done, which provides key inputs for the actions of development actors.
Thank you very much for giving me the opportunity to talk about our project.